Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com, and I'm joined here with somebody who needs no introduction, is Dr. Mark Tyndall. Mark, how are you?
Good, Brent.
So I wanted to bring you on. We're going to do probably a bit of a shorter episode here because there's no point to drag this conversation out too much. It's very specific. What's going on with Health Canada and the flavor ban in your mind?
Well, they've made it clear that this is a major consideration that they're doing right now, but it's just a bit of a black box when the decision will come down. So I think they've taken time to get input and feedback from this. It's clear that the people who vape have had a campaign to try to influence Health Canada and say how important flavors are. But they're up against a very tough pushback, and that the narrative is that youth vaping is still a big concern in Canada, and that the reason youth vape is because of flavors, and that there'll be a huge pressure on the government to come down with flavor restrictions, I think. But it's unclear what's going to happen, or even when the time frame is. So it could happen in the next couple of weeks. It could happen in 2 years. I don't know. The other, Health Canada obviously will have quite a bit of influence, but the other possibility is they could leave some of it up to provinces, and provinces have already shown that they have a big appetite for prohibition and clamping down on flavors. So even if Health Canada came out not hard and fast about flavors and left it up to the provinces, I think most provinces have shown that they've really accepted this idea that flavors help promote vaping to youth, and that they're bad. And that goes against everything that people know about adults who have transitioned to vaping, where flavors are 90% of what people use. They're one of the major motivations for people trying vaping in the first place. People enjoy the flavors. So it's really a problematic that we're still focused so much on the impact of flavors on youth, and forgetting about all the smokers who could really benefit from or enjoy. It even gets into this idea, well, why do we want people to have flavors if they enjoy it? People should not be enjoying this. They should be, we're okay with you using a safer product, but they should still be feeling guilty and not enjoying the experience, is kind of the public health thing. So we have to, we're battling against that people should have the freedom to enjoy their vaping, and should have the opportunity to use flavors. And the other massive downside of that is that since people do value flavors, they will continue to use flavors, and that will have to happen then in an unregulated manner. So people will learn how to make their own. Other underground operations will come up. People will find ways to do it. Because vaping's not illegal, people probably won't be that afraid of doing it. Probably the penalty to do that won't be great. We're not going to fill our jails with people who are making flavored vape. So I think it could just turn into a total gong show as far as what people are actually getting and using. And then it brings up the idea of a valley, which is kind of the ultimate bad downside of prohibition. You could imagine that, a whole shipment of adulterated flavored vape could get out there, and a lot of people get sick. It just makes the downside of prohibiting these things is just so predictable. But usually we don't think about these unintended consequences of prohibition.
Well, that's surprising, because the professionals that should know the most about this are Health Canada, right? Health Canada are the experts. And so when it comes to exploding the black market and so forth, they should understand that this is an exact consequence of a prohibition.
Yeah. Well, I mean, that is very difficult concept in public health, because it's so, much like just abstinence-based approach to cigarettes. Well, okay, it can work for a few people, and but the missed opportunity and these unintended consequences of people continuing to smoke or people using unregulated products is just so predictable. It happens all the time with everything we do, and but I don't think Health Canada or provinces or public health people have really learned that lesson very well.
So if I'm to understand your position here correctly, now we're shooting this interview a couple of weeks before we're airing. So is there any reason why we should expect that by then that something would change? Or am I to understand that based on your understanding, a flavor ban is still likely?
I think it's likely. It might be punted down the road a little bit. I mean, almost all public health right now focuses around COVID. So, I mean, there is a lot of noise out there. And I think vaping on the whole has kind of gone a little bit quiet in the last 6 months or so. And so I don't know. But the government is committed to making some announcement around flavors, and it's just unclear whether they'll punt it down the road for a few more months or whether by February they'll come out with some statement. And I would predict they'd leave some flexibility, wouldn't come out with a total flavor ban, but would leave a lot of discretion up to the provinces. And then that would be another whole disaster, like, because the provinces, I think, will always err on protecting our youth, and or they think they're protecting our youth, and then they will ban flavors.
So let me ask you, in Health Canada's regulatory impact analysis of the proposed flavor ban, they pretty much outright said that, they expect that there will be a certain percentage, and it's not small, of current vapors who won't make that switch to the disgusting flavors and will end up going back to smoking. How is that possible that Health Canada could even admit that?
Yeah, no, I just think it's back. The way they justify that is back to, well, if there wasn't vaping, then they should quit anyways. Like, it's just not, it's still back to the status quo. Cigarettes are bad. We know people can stop if they want to. So why don't they just stop? So I don't even think they're that. Yeah, they won't. In public opinion, if we showed that 20% of people who went back to smoking, I don't think there'd be a huge backlash. I think people would just kind of shrug their shoulders. Well, they shouldn't have been vaping in the first place, so now they're smoking again. They were smoking anyway. So it's really, I'm being obviously overly blasé, but I think that's kind of the shrugging shoulders that would happen at Health Canada. They're not really responsible for that. People want to do that, but I do think that the other bad unintended consequences were those 20% of people will find ways to get flavors. They will find that unregulated products or make their own, and why wouldn't they? I mean, it's pretty easy to make flavors. There's nothing magical about it, but I think it can go wrong though. Like, you can, like, we don't, the whole idea is that we don't want people mixing up their own stuff. We need to have some regulation there, or things will go wrong.
I mean, I think you're right, Dr. Tyndall, with regard to that base thing. Well, if 20% of vapors don't make the switch over to the disgusting tobacco flavors and they go back to smoking, like you said, they were already smoking in the first place. So it gets them back to status quo, and now we'll just harp on them to quit.
Yeah, no, I think that's the way they justify it. But you just think anything else, though, any other health issue like that, if people were doing something that's very damaging to their health, switch to something that wasn't damaging to their health, and then switch back again, I mean, people would have a fit. But in smoking, we just, we're just so blasé and just accepted that. So we wouldn't do that with any other substance, but or any other, but if somehow tobacco, our public health can get away with that, and people just shrug. Well, I do think that Health Canada has tried to walk sort of a lot. I mean, the official statements and the official website acknowledges that vaping is safer than cigarette smoking, which I think is important and probably further than a lot of countries have gone. So I think that's good. But then not to commit to trying to get people to vape then. So if it is safer, you think it will save lives, save healthcare dollars, then it only makes sense that you come up with policies that would try to encourage people to get off cigarettes through vaping. And so it's just a little bit incongruous to make that statement and then say, oh, by the way, we're going to do everything we can to disincentivize vaping and make it harder for people and tax it the same and all these things that they could be doing to make it more attractive. They're not. They're doing everything they can to make it less attractive and allowing the misinformation that is pervasive that you might as well smoke because we don't know vaping's probably just as bad for you. So who cares? And that's just so wrong. So,
Dr. Tyndall, one of the things that seems to be the case in Health Canada's analysis of the flavor ban is the assumption that a teen will start vaping nicotine and then will move to smoking cigarettes and then become ill with smoking-related illness and die and thus have a cost to society. And so the cost-benefit analysis of the flavor ban is preventing that death 40 years down the road from the start vaping, vaping leads to smoking, smoking leads to illness and death.
Yeah, well, I think that's a narrative that's very popular, and that's what parents have been told, and that's what youth have been told. There's really no evidence that happens. I mean, kids will try stuff, and probably it is more attractive to try a flavored vape than it is to try a cigarette. I mean, who wouldn't? So, but there's just no evidence that person will go on to use these vapes for a few weeks and then say, oh, well, you know what? I'd really like a bigger hit of nicotine. Maybe cigarettes would be really good for me to do. I mean, that just isn't the way people think. And the cigarettes are still stigmatized and vilified, and people are not wanting to do it. And so I think that all these statistics that are out there about the number of youth trying vaping are real. I mean, a lot of youth will try vaping, but the 6 months or a year later, they're not doing it anymore, and they're not smoking. Like, I mean, we have that data. The smoking rates in youth are going down as we expect that they would. So if the youth vaping crisis has been around long enough now that I guess we'd see increased youth smoking if that's how they started. And clearly we're not seeing any of that. So it's been a lot of moral panic around the youth, and it just hasn't played out the way that the scenario that you just outlined has. And there will be people who end up smoking. Some youth will end up smoking for sure, and whether they tried vaping first or not, I mean, it's not a gateway. The good thing about vaping is if kids try a nicotine product, we'd rather them try a vape than we would cigarettes anyways. So I think they serve a purpose that way. And the other thing we haven't touched on is how this is really a class struggle. This is a socioeconomic problem. That, again, when I say that people aren't being listened to who are smokers because of stigma, it's also socioeconomic. It's by far people who start smoking now or people who continue to smoke are least able to afford to do it from a socioeconomic point of view. And so it's really a class struggle. And again, that's why the voices of people who smoke are often not listened to, because they just are not prominent enough, and it's just not it just goes along with being poor and poverty and all these other things that we kind of mash in there, and it really says, a lot of bad things about our society when we really don't care about people who are worse off than us.
It's been 3, maybe 4 years since we first met and started doing some coverage with you. Have you lost some respect for colleagues in public health?
I mean, I try to keep, I have to work in this area. I mean, I don't, this stage of my career, I don't really care as much about what people think, but I think there should have been a bit more movement. I think it just more entrenched thinking. It hasn't really progressed very well. I think, when I think about what I was up against when I first came, when I first started thinking about this, you would think there'd be some movement, but it's been so slow. And it is frustrating, to be honest. And my other thing I'm involved in is the overdose crisis. Again, banging my head against the wall for 6 years of people just dying. I mean, it really, public health is just a very slow moving thing, and not really open to innovation or change very much. And there's just so many, with cigarettes especially, there is a lot of undeclared vested interest in not doing anything. Like, there's a lot of people that are doing fine from the status quo. People are, doctors are still making money on treating people with tobacco related illnesses, and the governments are getting tons of money from all the tax revenue from cigarettes. There's just not, the people that are really suffering are the people that are currently smoking, or are going to eventually could die from a smoking related illness, and their voices just aren't that heard. And since it's such a stigmatized thing in the first place, it's very hard to be an advocate. It's very hard to be a pro smoking advocate. Like, who would listen to you? Like it's not a sexy thing. We've pushed people down so hard and made them feel so worthless and just such a drag on society. It's just such a stigmatized area that it's really hard for people to get their voices out there and say that they totally deserve a safer product. I mean, I think my constituents are, right from the beginning, they're people who are going to die of cigarettes, and they should have an alternative. We have something better to offer them, and we're doing everything we can to spread misinformation and make it hard for them to switch. And we should be making it easy as we can for them to switch. And we just have not done that.